It was found accidentally, completely out of the blue, that I was very sick and I needed to get help immediately, or else I would be dead. Well, I was a very, very healthy teenager, didn't have any symptoms. I enrolled in nursing school, and because of that, they required full blood work, and the results absolutely shocked me. They told me that my kidneys were dying, and I needed to get help immediately. So with no history of any kidney disease in the family, I did not even know what to do. So fear led me to research, and research led me to Northwestern Medicine. I picked up the phone. I was very scared, and the person who answered asked simple questions that a 17-year-old could easily answer. And that phone call that I made to Northwestern made this death sentence go away.
When we met with Karen, we talked about 3 basic options. There's dialysis, there is a deceased donor kidney transplant, and then the best long-term outcomes we can offer somebody is a living donor kidney transplant.
For me, it was an easy decision. She's family, she's my only sister, so giving up a kidney was pretty easy.
So because of Karen having a sister who was such a good match, we had another option, a very innovative clinical trial where we can use stem cells and a kidney from a living donor to try and achieve something called tolerance, where we essentially trick the immune system of the recipient into seeing the organ from the donor as part of the transplant recipient. This therapy eliminates the need for lifelong immunosuppression, which allows people to live a much more normal life than individuals who are chained to these anti-rejection medicines, which have all sorts of potential side effects.
Dr. Leventhal had a lot of energy and enthusiasm and great passion for the research that I believed in him. I believed that he was my way out of the hole that I was in. Waking up from my surgery, I felt the pain, but I loved it because I knew I was alive. I knew that everything was going to be fine.
We knew within a month of the transplant that we were on our way to getting her off of immunosuppression over the next year.
Eventually, after this ordeal, I met my now husband, and we knew the potential side effects of the clinical trial, knowing that I might not have a baby or even get pregnant, but we took a risk and found out we were pregnant. And Dr. Leventhal was the very first phone call that we made to break the news.
So after Karen shared her big news with us, I shared some big news with her. We told her that this was a first anywhere in the world of a patient becoming pregnant who was a combined kidney and stem cell transplant recipient off of immunosuppression. And the ability to conceive, fertility, with some of the treatments that we use to achieve tolerance was an unanswered question, and Karen was helping us answer that question.
9 months later, we welcomed to the world Zyla, our baby girl.
It really was a fulfillment of what we want for our patients, and we're very excited about the future potential for this approach that we've pioneered here at Northwestern.
Who would ever thought that my life turned out like this? I am married, I have a perfectly healthy baby girl, and I am now a nurse at Northwestern Medicine, and I am excited and happy to be part of the team. I beat the odds. I am very blessed.